Greetings. As part of your recovery process here at St. Anthony Community Hospital, we have included mindfulness practice as an integral part of your body's ability to heal. Mindfulness, by definition, is being fully aware by paying attention on purpose from moment to moment. In practicing mindfulness, patients recovering from surgeries had less pain, reduced severity of their pain, less anxiety and tension, and healed 4 times faster over 8 to 10 weeks than people who did not practice this modality. I am going to share with you an example of a type of mindfulness called the body scan, and encourage you to practice daily throughout the next 8 to 10 weeks to maximize the benefits mentioned earlier. This should take about 30 minutes a day, but I can assure you that your time will be well spent as you explore this modality, not only to reduce your pain, but also to open yourself up to a new way of viewing your world in a more relaxed frame of mind. In fact, mindfulness is designed to help you enter a state of deep relaxation that you can carry with you anywhere, and it is portable and it's also free. So now, if you just follow along with my instructions and try to remember, it is not so important to listen to what I am saying, but rather being aware of what you are experiencing from moment to moment. So let's begin by arranging yourself in a time and a place where you won't be interrupted, a place in which you feel comfortable, either lying on your bed or sitting in a comfortable chair, wherever you feel most comfortable. And think of this time as an opportunity set aside just for you, a nourishing time for you to give yourself some positive attention, fostering your own body's ability to heal. Time you deserve to give yourself and needed to tap into your own ability to heal yourself within yourself. And remember not to try too hard to relax, as this will only create tension. And if you find yourself carried away by thoughts, you are not doing anything wrong. Just gently bring yourself back to the practice and the part of the body we are focused on. And now, slowly bringing your attention to the fact that you are breathing, not changing the breath in any way as you lie here, just becoming aware that you are breathing. Feeling the sensations in this region as the breath comes into your belly and expands gently, and as the breath moves out of your body and the belly deflates. And just following along with your mind's eye the rhythmic movements of your belly with each and every breath. The rising of your belly on the in-breath and the falling on the out-breath. And now, on a more intentional breath, breathe down deep into your belly, and on the out-breath, just let go. And as you let go, and when you feel ready, let's shift the focus of our attention to the left toes on the left foot. Just taking your mind, moving it away from the belly and down the leg, all the way down to the toes of the left foot, making them center stage in the field of your awareness. Taking a moment to really tune into them, perhaps distinguishing each one of them from each other. Or perhaps feeling the sensation of moisture, or tingling, or pain in this area, or the sense of contact between the toes. Whatever it may be while you're here, lying here, whatever sensations you feel is not important, but just feeling your toes as they are, right here in this moment. Being aware as well of whether you are experiencing these sensations or lack of sensations as pleasant or unpleasant, or neither pleasant nor painful or unpleasant. not judging yourself harshly, allowing all this to merely be held in awareness as we lie here without doing anything or having to be anywhere, just lying here from moment to moment. And if you find yourself caught up in a thought and the thought stream, just know that this is perfectly normal. And just help yourself carry that thought in your mind's eye for just a moment as you bring your focus back to the toes themselves as you lie here, attending to the toes of the left foot. Seeing if you could feel or imagine the breath entering your lungs, passing way down to the body through the left leg into the left toes. And seeing on an in-breath if you can feel or imagine the breath coming all the way back up from the toes and through the foot and the leg and out through your nose or your mouth on the out-breath. And now, when you're ready, taking a slow, deep, more intentional breath right down to the toes, cradling it for a moment. And then on the out-breath, as the breath lets go, let go of your toes, watching them dissolve in your mind's eye. As we shift our focus and attention now to the bottom of the left foot, the sole and the instep, and to the heel of the left foot as it's making contact to the surface you are lying on. Be aware of all the sensations here, or perhaps lack of sensations, just as we are with the toes, breathing into and out of this region of the body, moment by moment, as we lie here, bringing the mind back now to this region whenever we feel we're carried off by the thought stream, which is very possible. And we are a thinking human being. Thoughts are perfectly normal. But when you do focus on a thought, try to just put it in your mind's eye and bring yourself back to the region of the body we are focused on. And now, when you're ready, breathing right down into the bottom of the left foot, and on the out-breath, letting go of it as the breath releases. And we shift our attention now to the top of the left foot. And let's include the ankle and the shin and calf of the left leg. Breathing into the left leg in this region, and on the out-breath, just letting it go as we sink deeper and deeper into the surface we are lying on. And as we let go, let's shift our focus now to the left knee, the left side of the knee, the right side of the kneecap, any sensations you feel in this area as we lie here from moment to moment. You might feel some tightness, tension in this area, pain, whatever it might be, or lightness. Just breathing down into the knee on an in-breath. And now on an out-breath, letting the knee go too on this side of the body as we lie here. And now gently shift your awareness to your left thigh. And let's include the left hip on this side. Just becoming aware of what you're feeling in this area. Any heaviness, you might be feeling the contact of the chair or the bed against this area. Tingling, numbness, whatever it might be. Just becoming aware of the sensations here. And now, on an in-breath, Breathe down into this area. And on an out breath, just let go as the breath lets go. And as you let go, move your awareness now to the right big toe on the right foot. Feeling the toes as they are in this region. Any tingling in the right big toe, any tightness. Perhaps you feel the fabric of a sock or the shoe. Any sensations that are arising here, or any emotions that are arising at this moment. And let's shift our awareness now to the right bottom heel of the right foot. Just allowing yourself to feel any sensations here while you're lying here. Just being open to the feelings you feel here from moment to moment, whatever they may be, or lack of sensations. And on an in-breath, let's just let go of the right foot. On an out-breath. And shift our awareness now to the top of the right foot. And let's include the ankle, breathing with the whole of the right foot, moment by moment. Whatever is here to be felt. Breathing in any awareness that we have in this moment and region of the body. And breathing out on an out-breath, just letting go of the whole of the right foot. As we shift now our awareness to the right lower leg. And let's include the right knee. Whatever sensations are here to be felt as we lie here, whether it's tightness or heaviness, or pain, or numbness, whatever it may be. And as we breathe in to the area of the right knee, just letting go on the out-breath. Watching the right lower leg and knee dissolve in your mind's eye as we move now into the region above the knee, to the right upper leg and thigh. And let's include the right groin and the right hip. Just feeling any sensations that are here. The outside of the hip, the inside of the groin, any sensations of the pressure of the chair or bed we are lying on in this area, any heaviness. And when you're ready, breathe down into this area of the right thigh. And on an out-breath, letting go here too. As we move now into the region of the pelvis and the buttocks, as you're making contact with the chair or the bed. And now let's direct our attention to the lower back, to the lumbar spine coming out from the sacrum, which forms part of the pelvis itself. The low back being particularly prone to tension and fatigue and strain, and just breathing in with whatever sensations we are aware of as we tune into the lower back, letting the breath penetrate the entire region, allowing whatever sensations we are experiencing here to be as they are, cradling them in awareness, letting any tension go as you breathe out, and any tightness or holding or bracing in this area, or any intensity of sensation at all, Just be included and invited to flow out with the out-breath to the extent that it will. And as you breathe out of this area, just letting it go and moving now into the region of the belly and the lungs and the rib cage all around this area. Feeling the belly rising on the in-breath and falling back towards the spine with the out-breath. Any sensations you recognize here, or any thoughts or emotions as you're seeing your belly rise up and down as we rest here in awareness with each in-breath and out-breath from moment to moment. And now when you're ready, taking a slow, deep, more intentional breath here, feeling it fill the entirety of the abdomen, cradling it for a moment, and just letting it out as the out-breath dissolves in the air, allowing the entirety of this region of the body to just soften and dissolve in your mind's eye. As we now bring our awareness to the region of the neck and the shoulder blades and the collarbones and the upper back, just breathing with any and all of the sensations in this area as the body prepares, as the heart beats in the chest, feeling the rib cage expand and allowing any tightness harbored here to release on the out-breath. The shoulders and the shoulder blades are a source of tension that we carry with us from moment to moment. Just breathing into this area at this moment. And on the out-breath, just letting it go as we breathe out. And move your attention now to your face, to your jaw, paying attention to your lips, allowing this area too to soften. As we breathe into this area, and on an out-breath, just letting the tension flow out. And move up to the eyes, and the temples, and the forehead, just allowing the breath to help you soften this area. As you breathe out, let the tension out. And as you breathe in, feeling all these sensations that are arising in this area. As we move now to the whole entire body as we lie here, feeling the relaxation as you breathe in, and as you breathe out, just letting the entirety of the body let go on an out breath. And as we lie here, taking notice of this deep, relaxed state, of this stillness, of your body just as it is, right here, right now. In this moment, congratulate yourself for having made the time to nurture yourself in this way. Perhaps as well forming the strong intention to keep practicing regularly over the next several weeks and perhaps months, to befriend yourself in this way over and over again, to form a deep bond in this wake of awareness and relaxation, feeling it, and feel how it will change your life for the better as you practice mindfulness from day to day. I wish you the best of luck through your surgery and through the healing that comes after.